As you can see, our number of COVID-19 cases continue to be extremely high, especially when you compare to where we were in October. We unfortunately yet have to see a downturn. We are averaging an extremely high case rate, 242 cases per day. That is the highest average we've had since the onset of the pandemic. And as you can see from this slide, we've had a significant increase since Thanksgiving. Cases have increased by 50%. And while cases remain far too high, the rate of increase of this virus has slowed just a bit, the rate of increase. This indicates that we still have time to turn this dire situation around and, as a result, save hundreds of lives. Indeed, right now, as I speak, we could be at a key inflection point. An increase over this next holiday period could put us over the edge into a truly catastrophic situation. We cannot afford another increase in cases, a further increase in cases, especially including an increase like we saw during Thanksgiving. In contrast, an alternative is a leveling off of the rate of increase, and this could be followed by a decrease. While hospitalizations would continue to increase over the next few weeks, the worst of this third wave would be avoided. And for this to be reality, we must avoid a Christmas and New Year's increase. And we need your help in doing that. Next slide. Look where things stand with regard to our intensive care unit beds across the state. Today, the Bay Area has only 13% of available ICU beds to treat the sickest people. And right now, Santa Clara and San Mateo, our neighboring counties, have no beds for any ICU patients. Here in San Francisco, the number of COVID positive patients has increased by 27% in just the past week. We have a total of 286 intensive care unit beds in San Francisco. Now that may sound like a lot to some people, but 207 are currently filled with patients with COVID and non-COVID illnesses. Given the continued rise in cases, we expect that our ICU and acute care beds will continue to fill rapidly with sick patients. The availability of beds, as well as having enough staff, the nurses, the doctors, the other people on medical care teams, is the backbone of our healthcare system. Having enough beds and having the healthcare teams is vital to our ability to keep people alive and get through the most serious illnesses of COVID-19. And this status is currently gravely threatened. Imagine not having a hospital bed for your mom or your dad, your grandmother, or even your child, or any other loved one. Imagine them getting suboptimal care, not getting the care that we have come to expect and we have a right to have in the city. Would you want that? I certainly wouldn't want that. And I know that none of us want our city, our region, to be in that situation. Nor do I want our dedicated and hardworking healthcare workers and first responders to be forced to take care of patients under the stress of a hospital surge. Right now, San Francisco is better off than some of our regional neighbors, but we are all interconnected. We know infection rates outside the Bay Area are much higher than in San Francisco or the surrounding region. For example, nationally, 47 of 50 states currently have higher COVID-19 case rates than San Francisco, ranging from almost twice as high in Virginia to almost 7 times as high in parts of the Midwest. So while we in San Francisco are in a grave situation, other places are unfortunately even worse off. This means people who travel outside of San Francisco and visitors who come from other areas are at much higher risk of being infected and spreading the virus. And remember, people infected but without symptoms are a major source of virus spread. You can still feel fine, but still pass the virus to someone who may get very ill and even die. None of us want that. As we head into this holiday season and with cases still accelerating at a staggering rate, we want to take every step possible to slow the spread and bend this curve. That is why we are issuing a travel order effective tomorrow, Friday morning at 12:01 a.m. The travel order will require anyone traveling, moving, or returning to San Francisco from outside the 10-county Bay Area to quarantine for 10 days. The quarantine requirement applies to visitors, people moving here, and returning residents alike. There are exceptions for medical professionals, first responders, essential workers, and others. We also strongly discourage any non-essential travel within the Bay Area region at this time. Please stay home this holiday season and celebrate with people in your immediate household. End slides, please. Now, I know that this is hard, and I know this is yet another sacrifice in almost 10 months into this pandemic. But we are at a stage that was unfathomable just a year ago. Remember, we have lost more people in this country due to COVID-19 than Americans who died in World War II. We are losing more people from COVID-19 every day in this country than we lost on 9/11. But we know how to beat back this virus. Precautions and containment will beat back this virus if we dig deeper and slow the spread. Something as simple as a face mask can stop the spread and stop people from getting sick. And avoiding gathering with people outside your household can prevent our healthcare workers from being overrun with patients this holiday season. We're the city of St. Francis, and we take care of one another, especially during the holidays. We are resilient and we are strong when we work together. We have done an amazing job of crushing 2 previous curves. And when I go outside, I see so many people wearing masks, social distancing, and taking care of each other because it's the right thing to do. Let's keep it up and pass it on. So many of us have canceled travel plans already. And that is because of you and your commitment to protecting your loved ones and your neighbors. This year, let's give the gift of health and do not travel and do not gather. We can do that next year. And let's ensure that we are all here for the vaccine. Please stay safe and thank you.